topic of my presentation is situation of the coronavirus in South Korea. In my presentation, I'd like to deal with two big topics. The first topic is how South Korea responded to coronavirus pandemic. The second topic is social impact of COVID. Before going into these topics, I will briefly review the current statistics, and then I will explain the key issues and responses across COVID epidemic in South Korea. Okay, let me first explain the current statistics. Now I'd like to review the trends. South Korea confirmed its first case of the virus on January 20th. Most of the first 30 cases were from China. We could track the contact details of the confirmed cases. After the appearance of patient 31, everything was changed completely. Confirmed cases have skyrocketed since that time. On February 22nd, confirmed cases hit 3 digits first time. The peak date was February 29th. Then we saw the decline of daily COVID cases. The difficult period with over 100 daily new cases was 3 weeks. Now, as of April 9th, the confirmed COVID cases is over 10,000. This diagram shows the daily new cases. The number of new confirmed cases across South Korea has stayed around 50 for last 4 days in a row. Let me explain the composition of COVID cases, domestic versus foreign, during the last 4 days. As you can see from this bar chart, we have seen the steady increase of proportion of imported cases. The coronavirus tester number was 204 as of April 9th. The COVID mortality rate in South Korea is 1.96. Compared to other countries, our mortality rate stayed low. Now, I would like to explain the issues and responses. First, the issues and responses across epidemic stages. Let me first explain the COVID outbreak stages in South Korea. The first stage, called import stage, was January. The second stage, called community transmission stage, was February. And this is the most difficult time for us. The third stage, called post-peak stage, was March. The fourth stage, called second wave stage, is April. These days, many new confirmed cases are from abroad. Insofar as we open the border, we will encounter with these new cases from abroad. Right now, we are at the crossroad. This is very critical moment for us. Now, let me explain the issues facing healthcare system across the stages. Across these 4 stages, we had to encounter with the newly emerging issues related to healthcare system. At stage 1, we had to deal with 2 issues. The first issue was to enhance the preparedness of healthcare system. The second issue was to contain the spread of COVID. At stage 2, we also had 2 issues. The first issue was to maximize the healthcare system's surge capacity. Handling the skyrocketing healthcare service demand became the prime issue. The second issue was to mitigate the spread of COVID. At stage 3, the issue was to increase the alertness of the healthcare system. We should keep the readiness of the system. At stage 4, to promote sustainability of the healthcare system becomes the issue. Since most healthcare workers are mentally and physically exhausted by going through stage 1 to 3, most of the healthcare systems have the same similar problems of workforce shortage. Usually, do not have a second alternative. So, how to sustain the system with the current available and limited resources becomes a big issue. Hence, the strategy to fight against the COVID is to maintain the healthcare system resilience. Let me explain the healthcare system response across the stages. At stage 1, we made the test kit rapidly. By using several channels, government kept sending the message urging the preventive actions. The Prime Minister created a task force of all government ministries and all regional governments. Government also made a coordinated effort with the private sectors. At stage 2, several creative measures were implemented. Contact tracing system was quickly made. Mass scare and rapid virus testing was done. Community treatment center was made to lighten the load to the hospitals. Government also made a contract with mask manufacturers to supply the public mask. At stage 3, voluntary social distancing campaign was emphasized. At stage 4, airport COVID testing was enhanced. Mandatory COVID quarantine was imposed to those arrivals from abroad. So, what outcomes did we get? We could flatten the COVID curve in short period of time compared to other countries. Nearly 9,000 tests per 1 million population were performed. The COVID mortality rate is nearly 1.9, which is lower than other countries. We could make this only with the voluntary social distancing campaign. There was no city-wide lockdown or panic buying. You need to understand our healthcare system to figure out why our system responses worked. The traumatic experience with the 2015 outbreak of MERS triggered the improvement of our preparedness. Since our government designated the biomedical industry as the growth engine for future economic development, we could develop the good soil for the bio companies. And South Korea was rated as fifth most efficient healthcare system. We had a problem of oversupply of hospital beds. We also have developed a good public-private partnership since we adopted the national health insurance system. However, we have healthcare worker shortage problems. They are overloaded. Let me explain the cultural context of South Korea. Because South Korea had a homogeneous culture, risk communication worked effectively. Because the yellow dust coming from China, Koreans have used face masks. Because we have collectivist culture, people voluntarily participated in social distancing campaign. Since Koreans are accustomed to overwork, we have high workload threshold point. Now I want to explain the issues and responses from system perspective. I want to explain the issues across input, process, output stages. In input stage, the prime issue is to prevent the surge of COVID cases. In process stage, the prime issue is to provide accurate and timely screening. Once screened, the next issue is to provide optimal healthcare services. In output stage, the prime issue is to prevent the healthcare system collapse. So, our strategies are as follows. In input stage, to encourage active prevention by information provision is important. To secure the medical supplies is also important. In process stage, fast tracking, testing, and quarantine are important. In output stage, reducing the load for healthcare system is important. Based on the strategy, we executed the following actions. In input stage, we actively adopted social distancing campaign. Government provided information through diverse channels. It leads to people's commitment to preventive measures. And also government provide the public masks. The airport quarantine was enforced. In process stage, 1339 call center was made. Testing system was quickly made. We also developed the contact tracing system monitoring. In output stage, we also invented community treatment center for minor cases in order to reduce the load to the hospitals. Now, the issue is governance. On the current situation, governance is important in deriving the concerted efforts from diverse stakeholders. State needs to interact with people, healthcare providers, and companies. Government should be able to allocate the limited healthcare resources based on the urgent needs. Government sent public health doctors to Daegu area, which was a hotspot. Information collection and dissemination is also important during the crisis. Several years ago, we loosened the laws on managing and publicly sharing information on patients of infectious diseases. Most Koreans had the consensus on the idea that public health safety takes priority over privacy. The South Korean government has implemented measures to provide the face masks to the public vary. The government made the contract with the manufacturers of face masks to secure more than 80% of their production. The price was set at nearly $1. People can purchase 2 masks per week. Now let me explain the people. People showed commitment. People also showed compliance with preventive measures. They showed the trust. So we didn't suffer the panic buying. Now let me talk about the healthcare providers. They are the real heroes. They showed the medical competence and commitment. They showed good preparedness for COVID outbreak. After year 2015 outbreak of Middle East respiratory syndrome, MERS, Korean hospitals have tried to improve their readiness to fight against the new pandemic. We also have other heroes, companies. Bio companies made test kits before the outbreak began in South Korea. Right now, several companies are in the process of developing vaccine. We also invented drive-through or walk-through test booths. Now let's get into details of our response actions. The first one is information infrastructure. We tried to provide transparent and comprehensive information to the public. Of course, the information provided by government should be valid, and it was real-time information. After the outbreak of COVID, our government quickly made official government website. And we also developed the regional alert message. Coronavirus apps, Corona map apps. We developed several online channels. The practice of sending smartphone alerts, informing people of an infected person's previous movements, has sparked concerns about personal privacy from Western media. The following actions resulted in public trust. Actually, this public trust leads to the participation of public in preventive actions. Next topic is a healthcare delivery system. We made the sophisticated patient journey map. Government did not officially use this concept. However, what the government did was to make the smooth flow of patients. Most Koreans were exposed to information through diverse channels. If anyone has a symptom, he can contact the 9339 call center or public health center. By using contact tracing system, government also traced high-risk groups. Those who voluntarily contacted the system or those who were traced were advised to go to the test center. For fast processing, we developed drive-through centers and walk-through booths. We developed the process and apps to facilitate self-quarantine. If tested positive, the confirmed cases are sent to the community treatment centers or hospitals, depending on the health conditions. Minor cases are sent to the community treatment centers. Severe cases are sent to the hospitals. By using community treatment centers, we could lighten the load to the healthcare system. To enact the contact tracing system efficiently, we developed a support system for epidemiological investigation. Let me explain the support system. Once the result showed the positive, then the confirmed case is interviewed by epidemiological interview team at CDC. CDC requests data access permission to police and credit finance association. And then they collect information, the personal information like transaction or phone GPS data. Thanks to this support system, now this collection process takes only 10 minutes. Just in 10 minutes, CDC can collect all the information. Then the collected information is cross-checked by infected patients. Then plotting the travel map, and they start analyzing the map, examining contagion area, identifying the source of infection, identifying the possibly infected groups. And based on this analysis, the information is disseminated to the public. Regional alert message is sent to the mobile phone. And also on the coronavirus apps, we can access to this information. Then in final stage, the real action is taken, like closure and disinfection of a contagion area. 9339 call center is kind of a gateway to testing center. Quarantine app was developed. Even GPS system was used to track the person. Community Treatment Center is the facility for monitoring the patients with minor symptoms. It is a buffer zone to lighten load for hospitals. Some facilities were provided by private companies. In this community treatment center, the following services are provided, like monitoring of health condition is 24-hour service. Psychological counseling is also provided. Of course, they provide emergency healthcare services and they already set up the referral networking. Now let's turn to testing infrastructure. We adopted the aggressive approach to testing. As of April 9, nearly 500,000 cases were performed. Nearly 10,000 to 20,000 tests are performed per day. We invented walk-through testing booths, as well as drive-through testing center to execute the specimen collection process safely and quickly. The test takes 10 minutes at most. Results are texted to the person, usually the next day, and is free, paid for by the government. We also have a dispatch team for on-site specimen collection. The dispatch team for collecting specimen actually visited the household. In Daegu, where the outbreak occurred, 94% of specimen collection was carried out by dispatch team. Yes, the bio companies, they produce COVID testing kit. We also have another bureau, virus testing labs. We have over 100 testing labs. In spite of our efforts, we still have unsolved problems. In Daegu City and Gyeongsangbuk-do province, where the outbreak of COVID community infection started, the following problems emerged: lack of medical supplies, lack of human resources, because the doctors, nurses, they're exhausted, fully exhausted with the workload for last several months. Lack of cooperation among provinces and social stigma. They had to fight with the social stigma to that area. Another problem is influx of infected travelers from other countries. There is a high probability of leading the second wave of COVID. In April 4th, 51% of infected cases are arrivals from abroad. So the current action toward the travelers from abroad is mandatory self-quarantine, 14 days. There is a debate going on border shutdown. Exhausted healthcare workers. Heavy workload would quickly leave the healthcare system short-staffed and overwhelmed. Okay, let me explain the social life. The physical distancing. There is no social activity. As you can see from this picture, there are very few people on the street. Suddenly, telecommuting becomes a workplace alternative. And wearing a face mask becomes an etiquette. And infodemics, we had to fight with infodemics. We encounter with several social issues. The first question was about how to reconcile public health protection and privacy. The second issue was about how to reconcile public health protection and religious practice. So the third issue was a scapegoat. People blame others. Now, let me explain the criticism of government. Failure in early action. The Korean Medical Association recommended repeatedly that the government ban the travelers from China to prevent the spread of the virus. But government failed to ban the travelers from China. Wrong messages. President predicted that the outbreak would disappear before long in February 13. President expressed optimism too early before the outbreak of COVID in Daegu area. Too early for optimism. True heroes? Doctors, nurses, and many other frontline workers are the real heroes. However, they are behind the scene. There is a politicization of COVID going on right now in South Korea. Thank you. And I tried to explain the current situation of COVID and also try to explain how we responded to this COVID pandemic. I hope our experience would help other countries. Thank you.